It's estimated that 44 million adults in the United States have a behavioral health disorder, yet fewer than half of them receive the care and treatment they need. Telebehavioral health offers tremendous potential to improve patient outcomes and expand access to quality care, so more people will get the behavioral health services they need. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Senior Writer with AHA. In this podcast, Dr. Jay Bhatt, Senior Vice President and Chief Medical Officer with AHA, discusses telebehavioral health with Dr. Shantanu Agrawal, President and CEO of the National Quality Forum, and Dr. Arpan Waghray, Executive Medical Director for Behavioral Medicine at Swedish Health Services in Seattle, and Chief Medical Officer for Wellbeing Trust.
This is Jay Bhatt. I'm here today with Dr. Shantanu Agrawal and Dr. Arpan Waghray. Thanks for joining me to discuss the critical need to address behavioral health issues, the benefits of using telehealth to do so, and strategies for overcoming implementation challenges. Dr. Waghray, you are on the front lines of behavioral health care delivery. Can you share a story that illuminates the issue and the opportunity, and what makes behavioral health care so well suited to using telehealth?
Oh, absolutely, Jay. Thank you so much for having me and leading this really important discussion. So psychiatry, being a highly cognitive discipline, lends itself naturally to this modality of care. And over the past 2.5 years or so, we've had the privilege of bringing mental health expertise to many places across our system where there was none, mostly critical access and rural hospitals. And we've served over 12,000 patients mostly in the emergency departments. And I have many stories to share, but the one that I want to talk about today is very close to my heart. A dear friend and colleague of mine who's a hospital medicine physician with me, after finishing her shift one night, went back home to find her 15-year-old daughter with an altered mentation and a suicide note. As you can imagine, this was devastating. She did not see this coming. She rushed her child to the emergency department. She was assessed medically and psychiatrically, and then discharged back home with a list of child psychiatrists and therapists to follow up with. Now, unfortunately, there was no one available for over 6 weeks or so, something that happens fairly commonly. But then also, the stigma was so strong that the child just did not want to be seen in a mental health professional's office. And it was around that time that we had just launched a telebehavioral health service for our own caregivers and dependents. And they were able to schedule a televisit with one of our therapists who was trained in cognitive behavioral therapy and dialectical behavioral therapy the very same day. And interestingly, the child was very comfortable with this modality of care, and primarily because she was able to do it from her home. She also mentioned that it was very comforting for her to have her dog by her side, and she was able to build a rapport with the therapist, worked with him for a few sessions, and then felt comfortable enough to bring her family into sessions, which were all in-home virtually. And after receiving some therapy, she was able to build some more adaptive crisis coping skills and get to the root issues, and things got so much better for her. Now, my colleague was so, her experience with this was so strong that she wanted to go out publicly in multiple forums and talk about this so that another person's child does not go through the same thing. And we're proactive, and we get telehealth to support our children earlier before we're in a full-blown crisis. So this is one that really resonated with me, and a great use case for how we can improve care.
Great, thank you. And one of the things we see with telebehavioral health is that it can overcome geographic distances and expand access to care. We also see that it shows telebehavioral health as an effective treatment service, and that it can address some of the shortages. But most importantly, it's getting people the right care at the right time. And I think the story that you shared, although unfortunate, sort of really lifts that point up as well. Now, Dr. Agrawal, you've been spending a lot of time on this issue in a number of different ways. our work together on this has been really important for the field in understanding approaches that they can take. What's your perspective in terms of why behavioral health care is well equipped to be addressed by telehealth?
Sure. Thanks, Jay, and thank you for the opportunity to be on this podcast. I really resonated with Arpan's story. I think that's a really important case example of why telehealth services can be really useful, and particularly in behavioral health. So, look, it's really clear that we still have significant access and clinician shortage issues throughout this country. We often think of that in the rural setting, but it's also true in urban settings, and I think particularly in the behavioral health space. Patients simply do not have sufficient access to the services that they need, whether it's issues with psychiatric disorders, schizophrenia, to substance abuse and treatment-related services. They're simply not being offered at the level that patients need. So I think first and foremost, implementing a telehealth approach can significantly help to address those access issues and give patients access to good services, great services, even some of the best clinicians, even if those clinicians do not work or live near them. I think, too, with behavioral health in particular, there's the issue that Arpan mentioned, which is stigma, right? So we know, unfortunately, these patients are often at risk for loss of follow-up, may not get the services that they need, because of the stigma that we place around behavioral health and psychiatric issues. And that's obviously very much a shame. I think technology-based approaches like virtual care and telehealth services can help to address stigma by making an alternative approach to getting care possible. So, a teenager may not have to leave school, may not have to leave their home even, in order to get the core services that he or she needs. Which can help to surmount some of the stigma challenges. Now, we as a society really need to address stigma. Telehealth won't do that, but at least it offers a way around this issue while we as a society are catching up to the real needs of these patients. I think that's really critical and can't be overstated. So we were, as you pointed out, at NQF, we've worked on this issue for quite some time. We've done work in telehealth to try to establish measures for telehealth services, and we're really excited this year to partner with the American Hospital Association on creating a telebehavioral health playbook, which is meant to be a real practical implementation guide for how delivery systems can employ and deploy telebehavioral health services. So I think that doing so is really important, and hopefully more delivery systems will take advantage of this resource so that we can get the level of service to patients that we all want to see.
Thanks, Shantanu. And I know NQF and AHA share a common goal to advance health in America, in part through guidance, resources, and tools that improve healthcare quality and outcomes with smarter spending. And I think this guide that you referenced, that we're so grateful to work on together with you, builds on historic work by both organizations to improve telehealth and behavioral health care services. And so we continue to look forward to engaging the field on providing support related to behavioral health, as it is a critical area of need in terms of our healthcare system. And part of what we learned in that conversation together is the importance of leadership commitment, organizational policies and clinical workflows, staff education and training, patient, family, and caregiver engagement, and then measurement, as well as wraparound services through community partnerships. And I think we'll touch on all of those issues certainly in the conversation here today. So, Arpan, let me come back to you and taking the story that you have and the frontline experience. In your view, what does telebehavioral health encompass?
Telepsychiatry is about providing screening, assessment, therapy, and pharmacology from a distance. So there's a lot of research that's been done to suggest that the evidence base is substantial, and it's comparable to in-person care in terms of therapeutic engagement, the quality of care, the validity of the assessment, and clinical outcomes overall. So it's the same kind of care that a therapist or a psychiatrist would provide in an office setting or an emergency department could be delivered remotely via telehealth. Because again, going back to this being a highly cognitive discipline, most of what a psychiatric assessment is about is getting a good history, a mental status examination, getting collateral information, providing a diagnostic formulation and a treatment plan, and all of this can happen fairly well with telepsychiatry. The other thing I would add, building on Shantanu's earlier comments, is that this is, not only is this helpful, it is comparable to in-person care and helps us with improving access in rural areas, but actually for some patient populations, this might be a preferable mode of delivering care. Patients with autism spectrum disorder who are very comfortable in their home setting, it might be very hard for them to get to an office. People with severe debilitating anxiety, homebound elderly patients. Another group that we've worked with that we found it to be very, very helpful is patients with postpartum depression. With a young child, figuring out childcare and going for weekly psychotherapy can be very, very hard, and delivering cognitive behavioral therapy in the comfort of one's home can be a game changer.
Thank you, Arpan. That gives us a good sense from the front lines of a healthcare delivery system. And Shantanu, I want to come to you and see what you're experiencing and seeing among your members and stakeholders that are working on this issue.
Sure. So, I think we see a lot of different stakeholders, health systems gravitating towards various technologies and starting to experiment with them, implement them. Telehealth has been around for a while now. There are a number of telehealth solution companies in the marketplace. I think the real question for delivery systems is how all in do they want to get on telehealth? There's lots of different approaches. We often think about the virtual video communication encounter, but there's obviously also asynchronous approaches using videos and images, remote patient monitoring, even getting into issues like remote monitoring of wearables. So there's lots of different avenues and approaches that delivery systems can take. I think what's core to keep in mind is that in order for them to be effective, I sort of think about three things that are necessary. One is you have to have a clear strategy around what you're trying to accomplish with all of these different technologies with a virtual care approach. So what are the end goals that are very patient-centric that you are trying to meet? Because I think that should then drive the solution, the implementation that you're seeking to execute. I think that number two is how will you incorporate that technology into your existing clinical workflows? So the last thing we want is for virtual care, telehealth to be implemented off to the side, so to speak, where it's just sort of an add-on that yes, clinicians and patients can take advantage of, but it's not really integrated into the work that the delivery system is already implementing. So we want rather the solution to really connect to referrals, to prescriptions, follow-up telehealth services, or even follow-up in-person encounters. There's got to be a way for the telehealth encounter to make sense with everything else, to make sure that patients understand what it's being utilized for, and just as important, clinicians understand what it's being utilized for. So I can't overstate the importance of truly integrating it as opposed to just executing it on its own. And the third, I think, major element that needs to be considered is how you will assess outcomes in a telehealth world, right? So, there needs to be a performance measurement approach to make sure that if what we are trying to get to is highly accessible care that is high quality and safe, that there are measures and other approaches being put into place to ensure that that is occurring. Again, no delivery system, no patient wants an approach that seems to offer great value, that utilizes new and emerging technology, but then ultimately produces interactions that are either low experience interactions for patients or actually produce bad outcomes or substandard outcomes. So I think delivery systems have to clearly be thinking about how they're going to assess the technology and the implementation to make sure it's working.
Thanks, Shantanu. What I heard both in your comments and Arpan's was this. Alignment with strategy is critically important, an integrated part of a system of care and appropriate use of telepsychiatry. in the settings that might be engaged in across the continuum. And I also think that in terms of thinking about telebehavioral health, it's important to consider payment, delivery models, and the challenges and benefits of each as you're thinking about the approach as a hub to spoke or site to site or direct remote specialist and other considerations may have particular approaches that are effective. Now, being successful in overcoming challenges requires the leadership team to be aligned and asking the right questions. So Shantanu, just building upon our conversation, what are 3 questions that leadership teams should ask?
So that's a great question. I think so here are the top 3 that I would have. First is, what are we truly trying to accomplish, and is what we are trying to accomplish informed by patients? Right? If patients don't buy the value proposition or the use case, then I'm not sure that there's such an argument for implementing the use case. So that's number 1. I think number 2 is, how are we going to actually do this so that clinicians are bought in and so that it feels integrated with the whole of the delivery system? And number 3 is, how will we measure success? So there have to be clear endpoints that any delivery system has in mind when working to implement telehealth or telebehavioral health to ensure that they are marching towards those goals. And obviously those goals too should be highly tied into what they have heard from patients and incorporating what patients really want to see in results.
Great. And Shantanu, just one of the things you talked about was sort of measures. And when we think about measures, and certainly the work that NQF is involved in, when it comes to behavioral health, what are measures that are meaningful and make sense for organizations to consider as they're trying to address their behavioral health challenges, and if they're particularly using telehealth as one of the approaches to do that?
Right, great question. So we put out a measurement report now over a year ago, really trying to better understand what kinds of measures are needed for the telehealth environment. So there's a broad report that I'd encourage you or the listeners to access off our website. I think in the case of a particular use like telebehavioral, again, if it's tied to a strategy, a particular end goal, and I think oftentimes that is assessing or addressing access, I think there have to be clear access measures that are really focused on the needs that you're trying to solve for. So if it's a rural access issue, then you have rural access measures. If it's urban, if it's time to service or time after that first urgent acute crisis, whatever it is, the specific access issue that is trying to be addressed, I think you've got to have measures around that, number 1. I think number 2, patient experience is really critical in this to ensure long-term buy-in, and as you pointed out, Jay, the buy-in of community resources. So I do think it's really important to assess the experience that patients and caregivers are having with the telehealth services, and again, to make sure that it's viewed very positively or that deficiencies are being addressed. And then number 3 is, I think you've got to assess clinical outcomes. And in that sense, telehealth is no different from the traditional in-person clinical encounter, right? It should be the same clinical outcomes that are used to assess the in-person encounter, because I don't think there's any good reason to hold telehealth to a different standard, either higher or lower, right? So if the goal is managing a chronic illness, then there need to be clinical outcome measures that really look at disease management, chronic illness management, behavioral health management to ensure that the telehealth services are working, and again, they're working at least as well as the traditional clinical encounter, right? So those are, I think, the 3 broad buckets of measures. Each has to be designed according to the specific program, the specific implementation approach, but certainly I see the need of all of those areas hanging together in a real balanced scorecard.
Great. I think those are all wonderful considerations in that approach to measures. Now, Arpan, could you talk from your perspective, what are the 3 questions you've asked your team in the work that you do in this area, or would ask given the evolving nature of the approach to behavioral health, and what are some indicators you use to look at success and progress?
Yeah, so I mean, I think you covered, like what Shantanu covered is pretty much how we started and approached this work. What are the problems we're trying to solve? What are our biggest pain points? And then how does telebehavioral health address those pain points? And what's the sustainable model that we're going to use? How do we start measuring what are our key performance indicators? How do we know we're succeeding? But I would actually take this a step further, building on the measurement the point that was just raised in the earlier part of the conversation. When I sit back and reflect and think about why behavioral health, care and outcomes are so poor, why have we failed to bend the curve on deaths of despair by suicide? I think there are three big issues. One is we lack measurement-based care, so just like the discussion that happened in the prior part of the segment. Then care is fragmented, so their medical, psychosocial, family supports are not coordinated. And then we have reactive episodic care, so there's crisis care without continuity. So think about examples of 52% patients who follow up 30 days post an ER visit self-harm. So there's just no continuity of care. It's always reactive. So as we think about this and we start building a telebehavioral health network, we're trying to address these very core issues as we start the program.
Thanks, Arpan. One of the areas you also talked about was this issue of deaths of despair and how we try to address some of the challenging behavioral health conditions in our country. You have a role with Wellbeing Trust as Chief Medical Officer, and you recently released some resources to help the field around behavioral health. Could you talk a little bit about the Wellbeing Trust and some of those resources that just came out? Our listeners may find value in them as well.
Sure, Jay. Thanks for asking about that. So Wellbeing Trust is a foundation that was created to advance the mental, social, and spiritual wellness of the nation. And our overarching goal is to save 100,000 lives from deaths of despair related to alcohol, suicide, and opioids over the next 10 years while improving healthy life years for all and promoting well-being. A part of our focus and the framework that we try to follow is based on three big things. One is we need to get the care right. So that is whole person integrated care with no wrong door. The second thing is to make sure that there are policies in place to get the care paid for so it's sustainable and access is always available. And then probably most importantly is creating conditions that promote well-being, so addressing the vital conditions that promote intergenerational well-being. So having that kind of a comprehensive approach will not only help us with addressing the crisis we have at hand, but to then promote well-being and healthy life for the next generation as well.
You've been listening to Jay Bhatt, Senior Vice President and Chief Medical Officer with the AHA, talk about the promise of telebehavioral health with two noted experts. This is part one of a two-part podcast. Stay on the lookout for part two, which will discuss implementation of telebehavioral health strategies.